Welcome to Modern Management of the Older Adult, brought to you by the Institute of Clinical Excellence.
Everybody, this is Shelby Blankenship, one of your MMOA TAs, and this is the MMOA podcast coming to you January 6th, 2025. I'm so happy to be here, and today we're going to be talking about who is at your patient's table. So this is a concept that I heard in another podcast, and I thought it was really interesting of talking about who's at your table and what we can use to kind of benefit like a full holistic health. And I think it would be really great to have these resources, not only for our patients, but honestly, even for ourselves. So I'm going to kind of go through a list and kind of describe why I think these specific individuals should be at your patient's table and just resources that you should have for them if they don't have this type of person at their table currently. So the first one I'm going to go through, and these aren't in any specific order, but is a social worker. This could be just a case manager as well, but I think it's really important to have social work involved, especially when we're dealing with the geriatric population, because while they might not need it currently, they might need it in the future. A lot of our geriatric folks that we see, they're either dealing with some pretty intense things from a medical standpoint regarding themselves, or they might just have aches and pains, but they're also having to care for maybe their elderly parents, or maybe even some younger family members. Maybe they are having to step in the situation of being the caregiver for some of their grandkids. And I think it'd be really helpful to have a social worker on board so that when they get into certain situations that can get a little bit more complex, or they're having to deal with multiple disciplines, they can have somebody who can help like steer them in the right direction as far as like what they have access to from an insurance standpoint, what other programs are available to kind of help save on cost. The next one I like talking about is elder care law. This is not just for people who have to go under like a conservatorship, or somebody maybe like has some mental health issues where they're having to get like some extra people when it comes to care. But this is more like, do they have a POA? Do they have a DNR? Do they have all these kind of like medical things, but also the financial side? You know, what's going to happen to their money? Say they do get dementia and like they are going to need like long-term care or skilled nursing for a long time. Do they have like that trust fund already built up? And having that kind of resource can help them navigate those situations so that they can be in a really good spot. The next one, of course, is therapy. This can obviously not just be for PT or OT, but definitely into speech. I've noticed quite a few folks that I've actually referred out for maybe some COG assessments, maybe to see either OT or speech, depending on what they're presenting with or who I have access to. But those resources are super nice to have. I feel like when I was working in the hospital, it was a lot easier because we were all, so connected. But when you're in the private practice or a little bit more siloed, it's really easy to kind of think you have to take it all on yourself. So having that opportunity to have those people that you refer out to when you're a little unsure, maybe they need some more COG stuff going on, or maybe they are having some swallowing difficulties that you notice when they take a drink of water right after they do some exercise. That's really, really helpful. The next individual would be a pharmacist. Now, it could be like a pharmacy in general. Like if you have like sometimes there's, besides like a CVS or Walgreens, they have like little mom and pop pharmacies, and then you can have like more one-on-one discussions with the pharmacists themselves. But just even having like that resource of like, hey, these meds look a little off, or hey, one of my clients just started on a new med and they're having these symptoms. Is that related to the medication, or is that related to something totally different? And having that resource so that they can go out and either find those answers for themselves, or you can at least provide them some contact information to go on and get some more information. The next one is a primary care physician. I can't tell you how many people have walked into our office, whether it's from a fitness side or a physical therapy side, and they do not have an established PCP. Having that resource in your back pocket of like who are actually good PCPs that you can refer out to, not only to, there's some wiggle room sometimes where like, hey, I've got some gym clients and they had like a flare up of back pain, and then I could just call the PCP and like, hey, are you okay with me seeing him for PT? Would you sign off on the plan of care? Like that's a great relationship to have, but also from like an actual medical side of when you got clients coming to you and they're like, hey, like I just can never get into my PCP, or I can never get a hold of them, or it takes 5 weeks to actually get in. Those kinds of people where you can actually have that direct conversation and be like, hey, they really need to get in this week. Can you come and see them or go in to see them? Those are great options. There's also more of the concierge PCP that we've been seeing a lot of. And it is an extra cost, but if your client is able to do that, I know that has helped a lot from just like an ease of mind that they have access to their PCP more readily versus having to just wait those long extended periods, or especially like during the holidays where things get a little wonky as far as staffing goes. That can be super, super helpful. As far as like a nutritionist and dietitian, I always kind of like to have one on board that I know is going to maybe manage not only like a hormone side, but also maybe like a fat loss side. There's sometimes they go together and sometimes they don't. I've actually worked with 2 different nutritionists, one that was more like a coach on how to like monitor my eating and doing where we did like a cut or any of those kinds of things. And then I've also worked with one to kind of help with hormones, especially like with some of our folks who are postmenopausal. There's a lot of things that can kind of flare up, and we want to make sure that their nutrition is in a really, really good spot. So that's another person that I really like working with. And if anything, like bringing these people in so that they can do like their kind of like 15-minute or up to like an hour like seminar to kind of give some more education of like what's available and what's out there. I've really liked, we've done that a lot here, doing a nutritionist. A lot of our folks really, really like that, especially in January. Everybody likes to go into the fat loss mode, which can be a little bit tricky depending on what things that they're navigating, which is another talk for another day. But that's a really great resource to have so they can have another person to help navigate that with. The last 2, I think, are some of the most like important ones and tend to be the most neglected ones. One is a mental health therapist, especially when dealing with this population. And I've noticed this a lot of times with women, is that they have had probably issues or a history of a lot of anxiety or depression for decades probably, and have not sought out like a mental health therapist. And so if you have somebody that could maybe come in and again do like a seminar or talk of just like some things that they are navigating, not only themselves, but like if they're having to deal with parents who are starting to need more assistance, whether it's physically, mentally, financially, like those kinds of things really can go a long way. And it can kind of give you another avenue to have that outlet where people aren't always dumping on you all the time, because it's really easy, because we have the most time with them, that we tend to get like really overloaded with a lot of burdens that people have. And sometimes it's directly related to their pain or whatever they're coming in with, but sometimes it's issues with their kids or their grandkids or their spouse, or just like a lot of hard things that happen in life. And so especially if you're dealing with any folks that like are having like a lot of chronic pain, like I always try to advise people like, hey, like I know this isn't maybe the norm for you, but do you have like somebody you can talk to that's not a family or a friend, that's like a professional? Because that would give you an outlet of learning some coping strategies so that you can feel more in control of your life, rather than feeling like you just dump on people and then you feel guilty about it, right? Like that's the whole point of having like a mental health therapist, is like being able to have that person you can go to and like learn strategies, rather than this like you hold it all inside, then you dump, and then you feel guilty about it, and you just go back and forth on that all the time. So that's another individual I would recommend. And then the last one is probably a little bit, I would say, kind of like out of our scope a little bit, but it's always super nice to have as a financial advisor. Some of our folks like really can hit some hard times when it comes to finances, and not saying like you need to be giving them financial advice, but having those people in your back pocket who are there to help navigate like these like kind of retirement and beyond situations. And especially if they're wanting to be snowbirds, or if they're having to deal with costs that they're not used to, somebody who can help set them up for success and kind of help like ease that stress is really helpful. Because ultimately, all of these are trying to tap into that meds checklist, right? We're trying to look at mindfulness with like our mental health therapist, maybe even like the pharmacist. We're looking into like the exercise portion with therapy, and maybe even going beyond that and going into like that wellness or fitness realm, like having that gym or that coach that you know would be really helpful for your folks. Diet with a nutritionist, dietitian, and then sleep, of course, is another important one. And that can go all the way back to social work, that can go to the mental health therapist, that can come to us for therapy. There's so many different things that we can kind of like tap into. And if we're looking at the human as a holistic human, we want to have these resources available for them, or at least be looking for them ourselves so that we can kind of help them be the best human they can be for the rest of the year, versus just being like, oh, we fixed your pain and then we moved on. So again, make sure like you're not trying to take on all these burdens yourselves, but it's always helpful to have that list of people that you recommend, because there's always going to be people asking and you're going to be a great resource for them. As far as next things that we have coming up for MMOA, January 13th, we're starting the newest cohort of L1, and it's all revamped. So I highly recommend, if you haven't taken L1 yet, please check that out. L2 with me and a couple other cool folks are going to be January 9th, and then we've got some live coming. January 18th is actually going to be here in Hendersonville, Tennessee. If you are here or close by and want to come check us out, that would be awesome. And then we also have one coming to Idaho in January 25th. I hope you guys have a great rest of your New Year time period, and hopefully this is helpful. Thanks.
Thank you for listening to the MMOA podcast. If you found this helpful, please share with someone that could benefit. And if you're looking for more practical content to help you better serve older adults, head over to www.mmoa.online, where you can learn more about our free resources, our community, continuing education courses, and our certification. Once again, that's www.mmoa.online. Thanks for listening.